So you're starting a retinoid and you're wondering how the heck to incorporate it into your current skincare routine. I'm a dermatology PA and I know how confusing it can be to incorporate a retinoid, but I also know how important it can be. This is by far one of the most time-consuming parts of my in-office visits because I find that proper education when it comes to retinoids is absolutely crucial into maximizing the benefits of these products, but also being able to tolerate them. Retinoids can help to diminish breakouts, fine lines, uneven skin tone, skin texture. They help to upregulate collagen production, and they're one of the few things that can actually improve the appearance of pores over time. Aside from sunscreen, I believe that retinoids are the single most important part of our skincare routine, and remember, these are long game products. You will see some results in a short period of time, but remember, the real magic is what's happening months and years down the road with retinoids. So here is my retinoid routine. There are a few types of retinoids, and to be honest, I use most of them in some rotation in my routine. If it wasn't my job to try new skincare products, I would choose one and stick with it because the results come with consistency. But as long as I have some sort of retinoid in my nightly routine, I'm happy. And if you want a breakdown of different types of retinoids, what they do, and who might benefit from which, leave a comment below and I'll be sure to make that video for you guys. Retinoids are powerful ingredients, so in general, especially when starting out, I recommend keeping the rest of your nightly routine pretty simple. Also, I should mention that I recommend using retinoids at night, not because they're photosensitizing or make your skin more sensitive to the sun, that's generally a myth, but because some retinoids themselves are easily deactivated by light, so we recommend using them at night to avoid that. That being said, it's still important that you're using sunscreen every day because what's the point in treating all these skin concerns if you're just gonna undo it with the daily UV exposure that you're getting walking your dog, getting your mail, or driving your car. Step 1, I'm going to go in with a cleansing balm. I strongly believe in the double cleanse because I have yet to be able to remove all of the day's sunscreen with just one cleanse. And I like to remind people that if you're using enough sunscreen, the amount that we actually need for protection, then a double cleanse is usually necessary to remove it at the end of the day. I've repurchased this one from Naturium a few times. It's the one I'm currently using and one of my favorites. It's extremely gentle and it's fragrance free, so it's kind of ideal for somebody starting a retinoid. I apply a small amount, really melt it onto the face with my hands, and then apply a small amount of water to emulsify. I always hear people say the word emulsify, and it sounds like a really fancy, sciencey term, but all you need to know is that emulsification is a process that happens when two ingredients that normally don't jive together, like water and oil, are combined, and you get this kind of milky substance. After emulsifying, I remove the cleansing balm with a damp washcloth. You want to make sure that if you're doing this, your cleansing cloth is nice and soft and gentle because even the roughness of, say, a regular washcloth can actually give you some exfoliation of the skin, which may make your skin more sensitive. Next, I go in with some sort of water-based cleanser as my second cleanse. My general rule of thumb when it comes to picking a cleanser is that if you have dry skin, you want to look for cleansers that have milky, creamy textures, and if you have oily skin, a gel or foaming cleanser is going to be more up your alley. Tonight, I'm using the Cubby cleanser. It's a nice gentle gel cleanser with coconut surfactants. It really removes everything left behind, but it doesn't leave my skin feeling stripped. I'll admit I do love a good lather when it comes to my second cleanse. This combo is usually plenty to remove all my tinted sunscreen from the day, but a little check I do is that when I'm patting my face dry, if any tinted sunscreen comes off on the cloth, I know that I haven't cleansed enough. After this, depending on your skin sensitivity, you can choose whether or not to use your retinoid during this step. This step is best for those who are using a gentle retinoid or who have very oily or resistant skin, or if you've worked your tolerance up with retinoids over years. Let me know in the comments if you want a breakdown of my favorite gentler retinoids because there are quite a few that I use in my rotation, and I think there's a place for all of them depending on your concerns and your skin type. Because I'll be going in with a prescription retinoid later, I am going to skip this step and go on to my next serum. As I mentioned, I've been using a retinoid for years, so because of this, I have a pretty good tolerance built up, and I'm going to go in with a separate treatment serum. But you can absolutely skip this step, and I recommend that you do if you're just starting a retinoid. Keep that as the only active in your routine and let everything else just be supportive. You can always add your favorite serum back into your routine once your skin is acclimated, which is exactly what I did. Tonight, I'm going in with Major Fade by Pillow Talk Derm. This has alpha-arbutin and kojic acid to help target hyperpigmentation and niacinamide to help support the skin barrier. Next, I'm going with an eye cream. I don't always use an eye cream, but when I'm really trying to take my time with my routine, I do. Eye creams can be helpful because they're formulated with specific eye concerns in mind and also with the delicate eye skin in mind. Tonight, I'm using the Caudalie Vino Perfect. This has caffeine as well as a tyrosinase inhibitor to help to reduce hyperpigmentation, and the ceramic tip is just really cooling and pleasant to use. This is where it gets a little bit nuanced. If you've seen me in clinic as a patient, you know that I tell you to do moisturizer first and skin than your retinoid. And that is because I'm likely prescribing a prescription strength retinoid. In this case, applying your moisturizer first will act as a little bit of a buffer, so you're less likely to experience irritation from your retinoid. Tretinoin penetrates pretty easily, so we don't have to worry about a little bit of moisturizer getting in the way. It's important to note that if your dermatology provider has told you to apply your tretinoin and then your moisturizer, that is absolutely not wrong. This is just a little trick that I give to my patients to help them ease their way into their retinoid and increase their tolerance. For moisturizer, you'll want to choose one that's incredibly gentle and has the right lipids to support your skin barrier. I find that the right cleansers and moisturizers are actually crucial when it comes to tolerating your retinoid and other active products in your routine. I think it's often overlooked just how game-changing switching up these products can be in your routine, especially choosing the right cleansers. I should note here that while this video is all about retinoids in general, I know that many of you might be watching after being recently prescribed a prescription strength retinoid. And while these tips will absolutely help, I want you to understand that it's important to have an open dialogue with your provider and ask them for their advice on what products that you should be using in your routine because they know your skin. But I've been doing this for quite a while online, and I get lots of DMs saying that their provider gave them no direction on how to use these products and what products to use with them. So it's also important to me that I guide you in this process. But just know that this is not personalized medical advice. This is just skincare education. And I know that many times you're told that your cleanser and your moisturizer doesn't matter, but the truth is it really does. Changing these products to ones that better suit your skin type is going to help tremendously in your tolerability of these stronger products. This moisturizer is a holy grail for me. It's a 1:1:1 ratio of triglycerides, cholesterol, and ceramides to perfectly mimic the lamellar structure of our skin's own lipid barrier. You just need a thin layer and then we can move on to the next step. Here's a little tip. If you notice that certain areas of your face get sensitive with retinoid use, you can use a thin layer of petrolatum in those areas before you apply your retinoid. These areas often include around the nose, around the mouth, and the lips, maybe underneath the eyes, and this will act as an occlusive barrier so that retinoid doesn't penetrate that area and cause irritation. This is more common with stronger strength retinoids, but can absolutely happen with more gentler retinoids, especially if you have sensitive skin. Now that my skin has been gently prepped, hydrated, and moisturized, I'm going to apply just a pea-sized amount of tretinoin. I'll evenly distribute it across the face. I know people seem to have a hard time with this pea-sized concept, but for tretinoin especially, it's truly all you need. You just need to evenly disperse before blending, and some formulations are going to be easier to blend than others. You'll hear that retinoids are beneficial for the neck and the chest, and they are, but stronger retinoids are notoriously poorly tolerated in this area because there's a reduction of oil glands when compared to the face. For me, I don't like to apply my prescription retinoid in these areas. I'll choose a gentler one. Tonight, I'm using the retinaldehyde 0.1% by Naturium. It's a really nice gel serum texture, and retinaldehyde in general is better tolerated than retinol, but also a little bit more efficacious. This is because retinaldehyde requires only one step to convert to retinoic acid, which is the active form that our skin uses, while retinol requires a two-step conversion. This product comes in two strengths, so you can start at the lower strength and work your way up, and this is also one that I recommend and one that I use often for my face. If you take away anything from this regimen, I hope that it's that your regimen should be pretty bland and easy when you're starting a retinoid, especially a prescription one. Your retinoid is truly the star of your nighttime routine, and it's going to be doing all the heavy lifting. All the other products are just meant to support your skin barrier to reduce irritation. Then once you've acclimated to your retinoid like I have, you can add in any other serums that you might want, but in general, I still like to keep my routine pretty concise. More is not more in skincare, and it's going to increase the risk of irritation and undesirable effects. I hope that this video was helpful. Please like and subscribe and leave any lingering questions down in the comments. My goal is really to be there for you on your skincare journey, so I'm here for any questions that you have.